Welcome to Focus on Liberia. Tonight we have a guest, Yassah Lavelah, to speak to us about women's reproductive health in Liberia and the state of women's reproductive health in Liberia. So welcome to our guests and welcome to our viewers. For those of you joining for the first time, please like our page. We also have a YouTube channel, Focus on Liberia. Please subscribe to our channel as well. So welcome, welcome. We have an exciting discussion tonight, or a very informative discussion tonight, and we're happy to have you. So to tell you a little bit about our guest, Ms. Yassah Lavelah, she is a registered nurse and the founder and chief executive officer of Mavi Maternal Empowerment Initiative, commonly known as MAME Liberia, a local organization that seeks to transform maternal and child health by empowering women, communities, and health workers to take positive actions that will improve maternal and child health outcomes in Liberia. In 2009, she earned a bachelor's in nursing from the Cottonton University in Swakopmund County. She has over 7 years of experience working in Liberia as a nurse, with a specific focus on the role of maternal and infant health in community development. She has spent over 10 years developing sexual reproductive health organization for young girls as a form of women empowerment to combat the alarming rate of teenage pregnancy in Liberia. In 2008, she partnered with her mother to create the Mavi Maternity Clinic as a social enterprise, which now serves over 30,000 women and children with no access to healthcare in Painesville City, Liberia, and supports more than 100 traditional midwives annually. In 2014, Yassah was selected out of thousands across Africa to form part of the prestigious Mandela Washington Fellowship for Young African Leaders, as a result of her accomplishments in promoting innovation and positive impact in the field of healthcare in Liberia. The fellowship was initiated in honor of Nelson Mandela by President Barack Obama as a flagship program that empowers upcoming young leaders in Africa through academic coursework, leadership training, and networking in the United States. Her work and leadership led to an invitation for her to apply to the prestigious Harvard Medical School, where she completed a master's in global health delivery and social medicine in May of this year. She climaxed her program with a research entitled Understanding the Factors Impacting Maternal Healthcare Delivery from the Lived Experiences of Women in Liberia. So welcome, Yassah. Thank you so much for being here.
Thank you, Danielle. Thank you so much for having me here too.
You're welcome. You are definitely welcome here. So before we jump into the work that you do, let's start off with your background. So where are you from? Where were you born? Where did you grow up?
Thank you very much. So Yassah, I'm from Lofa County, Salaye District in Liberia, to be specific. And I was born and raised in Monrovia, Liberia. And I grew up with my mother as a single mom in the Painesville Red Light area. Yeah, so usually when I'm speaking, I tell people I'm that girl from Gobachop, the Gobachop market. Yes, so I grew up there with my mom, and my mom is also a midwife. So I grew up with her in that area. I went to school. Part of my high school education was in Liberia. And then during the war, my auntie took me from my mom and we fled to Ivory Coast. And we spent some years in Ivory Coast. And after that, when Ivory Coast was about to fall, we fled to Ghana. And I stayed in Ghana and completed my high school. And after completing my high school, then I went back to Liberia to do my college education. Yep.
Okay, wonderful. And so before you came to the U.S. on the fellowship program, you were a registered nurse, correct?
Yes.
Okay, so tell us about your experiences in nursing in Liberia, what you saw, what you did.
Yeah, so my passion for nursing, I usually tell people my passion from nursing came from the fact that I grew up seeing my mom do these things, because I grew up in a home where my room was a delivery theater for the community we lived in, because my mom has built this career as a midwife in her community. So our house was like the go-to destination. Before I go further, I just want to say my mom had my last sister all by herself in a bush in Lofa.
Wow.
And that experience shaped how my mother considered giving back to the community. My mom is a certified midwife. She worked at different government facilities in Liberia, but in her community, everybody knew her to be like the doctor in that community. So even if women could afford to pay for healthcare services at the health facilities, they would prefer going to my mom first before they like can even think about the hospital. So 2, 3 a.m. in the morning, most of the time we were up. Our house was like Mavi, Mavi. So her name is Malvaola, and we affectionately call her Mavi. And then we have to wake up. We had to wake up, wait in the living room or wait outside, because there was a woman in labor, and our home was like the hospital. So that's why I tell people my passion for nursing actually came from that background, because I was at a very tender age when I started like helping my mom. Give me this, give me that, and then I just grew up knowing that this was a way of life. So during the civil crisis, when we fled to Africa with my aunt and I went to school, I later decided to become a journalist. But then when I talked to my mom, she was like, you really want to be a journalist? I thought you said you want to do nursing. So come back and do nursing. So I went back to Liberia and I did nursing. So before doing nursing, my mom had a drugstore. So after our house was like the delivery center, she later decided to open a drugstore. In that drugstore, she was using that drugstore to sell medication at the same time conduct deliveries. And then after the drugstore, when I got back from Ghana and went to Cottington, we decided to like build a clinic, because the drugstore was actually small. And since this was a need for the entire community, the community decided to rally around us. So by the help of the community, we're able to build a 7-bedroom clinic that is currently serving like the entire Gorbachev plus red lights. So we currently have that clinic going on. So when I graduated from Cottington, I worked in Phoebe Hospital for like a few months, and then I gave birth to my son, and I decided to move back to Monrovia to work with my mom, because I was like breastfeeding at the time. So I came back and we were working in the clinic. First, it was just me, my mom, and I working in the clinic and serving the community. And later we could not just keep up the burden, right? So I decided to find a job. So I got a job out of town with Buchanan Renewables as a registered nurse. So I was working with Buchanan Renewables, and then my salary was also helping to pay a few of the nurse aides and nurses we had working with us in the clinic. So over the weekend, I would come back to Monrovia, help to work at the clinic. And then when Buchanan Renewable left, I came back to Monrovia and continued my work with the clinic. And then I decided to find another job with EOW Hospital. I started to volunteer first, and then later I was employed. So I work with EOW Hospital. At the same time, I started my community initiative, carrying on sexual reproductive health education for teenage girls in the community. At the same time, distributing sanitary pads and also giving contraceptive. So while I was doing that work, then I decided, my brother and I, kudos to my brother Leo Johnson, my mentor, and we spotted this opportunity, the Mandela Washington Fellowship. And we decided that I applied for it because I was qualified, and we were looking for young African leaders who were giving back to their community, right? So we applied. But then when we applied, I actually forgot about that application. I continued to do my work in the community, continued to serve until we had the first Ebola case in 2014. At that time, I was with ELWA, and then they trained us, to be able to manage the case. Fortunately for me, I got accepted. The fellowship, I got selected. I went to the embassy and did an interview, and that was my first trip to the US. But that trip was like an eye-opening trip for me, because when I came to the US, I saw young people like myself doing great things in other countries, and I told myself, I can do more than this. And then I left in the US, Ebola got very serious. And then President Obama at the time said everyone those that were in the US should stay, and they were going to get them. But I wasn't at peace. My heart was trouble. I had my mom back there doing deliveries without PPE. She got exposed twice. She was quarantined. The fight that I was trained to actually treat Ebola cases and stuff. My entire family was back, and then I was like, what am I doing here, right? So I said I was going back. Everybody said I was crazy. I said, good. Since I'm crazy, I'm going back. My mom was angry. Everyone said I should stay. But hey, I went back. I didn't tell anybody I was going back. I just went back. I arrived at Broward International Airport, took a taxi. I went home. And my mom was crying. What are you doing here? Nurses are dying. I'm like, we are here. Whatever happens, it's going to happen, but we are all into it. I came back to work. So I went back to my job, and they said, my boss man said, I don't have a job for you. I can't believe you in Liberia. So I said, I am here. I want a job. He said, you don't have a job for me. So I went to MSF, and luckily for me, MSF took me. I was working as a coordinator for the community health volunteers. But then my clinic was closed because we never had personal protective materials.
Wow.
After my mom got exposed, the entire clinic closed. So then the school I came to here in Notre Dame, they emailed me and asked me, what can we do to help? I said, okay, just send us personal protective equipment. That's all we need. And luckily for us, we were able to do a container full of personal protective equipment. Within a month's time, they were able to ship that container to Liberia.
Nice.
Yes. So while I was there, I was training traditional midwives how to use the personal protective equipment in the Ebola crisis, because they were really dying. They were dying because all of the facilities were closed down. Only these traditional midwives were in the community serving. So when we got those materials, but then I can't just sit and allow these people die. So I started to conduct trainings for them, teaching them how to use the PPEs, how to put it on, how to remove it. And then I distributed some of the PPEs, gave them some of the materials, and we started to work, and God help us. I never got infected. I was working in the years, I was working in the hospital, and I'm working in the field, and God what was with us. We fought the Ebola crisis until it ended. And then after the Ebola crisis, I had a friend who I met doing a fellowship, and she was like, Yassah, what next? I'm like, I want to do my master's, but not in Liberia. So the organization and my school that sent the personal protective materials, they asked me to come back to the US and do like a presentation and tell them how helpful these materials were, during the crisis. I came back, I did the presentation, and then they were impressed, and they decided to continue working with us. So then I went back to Liberia because I still have my work going on. I kept working with the clinic. I kept working with ELWA until my friend saw this opportunity for Harvard and sent it to me. But that's a whole different topic. So let's cover because you asked for my experience back home before I came here. Yeah.
Okay, wonderful. Well, I guess the next question was going to be, how was your experience at Harvard? How did you get to that point?
Yeah, so as I said, my friend saw that opportunity and she was like, Yassah, this is you. I want you to apply for this program. But you and I know when we hear the name Harvard back home, what comes to mind? And then someone like me from a poor family, from a poor background, from a single mother, who never thought of Harvard, for someone to just ask you to apply, I told her no. I told her this school is a no-no, even though I want to do my master's in the US, but this is not one of the schools that I dream of. She was like, no, Yassah, looking at your work, looking at what you've done, this is you. Then I asked her, how will I get this whole thing funded? She said, no, just apply. And once you're accepted, usually it's funded. I was reluctant, honestly, but I just decided to apply. I told my brother, he said, let's go for it.
Wow.
And we applied. But honestly, I didn't pay any attention to that because it was like a no-no for me. After that, I got an email on, I think it was Christmas morning or the morning after Christmas, that I've been shortlisted as a semi-finalist. I'm like,
wow, what a Christmas gift.
yeah. So it was like a bittersweet experience. Honestly, I was happy and I was crying, but then I just told myself, I think this is God's doing. So they told me to prepare for a SCAP interview, which of course I was so nervous. Like, what am I going to tell these people? Where, right? Harvard University. I mean, so I was nervous. I talked to my friend. She was like, Yassah, just be yourself. You know what you did. You know what you've been doing. You know what you wrote in your application. So I went to the Skype interview. I was successful. I got an admission to Harvard. And then we got back to another fight of financial aid.
Yeah.
I couldn't get the financial aid the first year. I was turned down. And then I got frustrated. I said, okay, Katie, this is it. Now I've reached like just to the door to enter, and then I'm turned away. She said, Yassah, it's not over. They will ask you to defer your admission, just defer. I said, even if I defer for 10 years to come, I cannot afford this situation for this school. So I was frustrated, and I didn't defer until the deadline came and passed. So when the deadline passed, the school still emailed me and said, just defer and let's have your application on file. So I said, okay. So I reluctantly defer, and then the following year, which was 2018, by the grace of God, I got. So I was actually going for 50% scholarship. Trust me, I went to everybody in Liberia to help me.
Wow.
And people told me, you're shooting too hard, Harvard, or you can find something else to do. And I remember there were government officials who wanted to sleep with me before they could even allow me to meet the president or so. But luckily for me, the day I was to go and meet the government official who told me to go to his office, he was going to like introduce me to the president. I got an email that I got 100% scholarship.
Oh my goodness, what a blessing.
So I was going for 50% scholarship, but I got 100%, including my housing, my feeding,
wow,
everything I needed to be at Harvard. So it was like a dream come true. After all the discouragement people gave me, people told me this was just something I couldn't achieve. But I kept pushing until I got that scholarship. And when I got a scholarship, the next thing was I needed to come to bring my son. I was like, I can't leave my son here. My mom is busy. She won't be able to take care of my son. And then I was worried again. Luckily for me, I got another scholarship from an organization here in the US to take care of all of the expenses for my son.
Wow.
And that was just that. I got all the scholarship, and then I came to Harvard. When I came to Harvard, honestly, the name outside, when you hear the name outside, it's kind of intimidating. So I was going with that mind, like, this is a big school, it's rich people, children, and stuff like that. But the people, like, in my department, the Department of Global Health and Social Medicine, they made my stay so easy for me, because I remember when I went there with my son, it was difficult for me to have my son at the same time going to school. I remember my program director used to babysit for me. She would take my son, carry my son to her office. They would sit there while I go to class. Sometimes she would take him to her house. He would spend some days there with her. And I mean, it was just a welcoming environment. I mean, coming from Liberia, looking at my educational background, we don't know anything about writing, about plagiarism or so. We just write.
Right.
So I remember my first paper, it was all messed up. I plagiarized. I didn't even joke with it. Then they called me, they said, this is a big crime here. They said you get expelled from the school for it, but they were so supportive. I remember they gave me, they assigned extra writing teacher to me. They talked to me, they said, we know, like, this is a global health program. We have students from different backgrounds, different part of the world. We understand exactly. And they made me feel like I had, people were there to support me despite of the fight that I never knew what to do at some point in time. And they helped me. It was like a complete, I don't know, it was like, we were like family, right? My classmates, we were there to support and help each other and everything. So it was going okay until coronavirus came in. But before coronavirus, I had to go back to Liberia to do my research, because I was doing a research.
How many years was your program? Okay, we seem to be having some technical difficulties, but if you're just joining us, today we have with us Yassah Lavelah, who was a Mandela Washington Fellowship receiver, and she currently has the Mavi Maternal Empowerment Initiative, which supports maternal and child health in Liberia. And if you give us a moment, we'll be able to get her back. Right? And for some of you who are just joining, in 2014, Yassah was selected out of thousands across Africa to form part of the prestigious Mandela Washington Fellowship for Young African Leaders. And when she was done with this program, she returned to Liberia against the wishes of her family to help during the Ebola crisis. So she is a registered nurse and wanted to come back to Liberia to offer her expertise to the country in, that time of major need. And as she was explaining, one of her friends that she made while in the US on the fellowship encouraged her to apply to Harvard University. And, by God's grace, she was accepted and received a 100% scholarship. So amazing story. We're in the middle of the story, and hopefully we can get Yassah back shortly. And then we will move into the work that her organization does, Mavi Maternal Empowerment Initiative, right, that helps with maternal and child health. So we'll get into that shortly. And we have Yassah back with us now.
I'm sorry, I don't know what happened. My entire computer just went off. It's blocked. I don't know what's happening.
Oh, that's fine.
I'm very sorry. I apologize.
Oh, that's okay. Are you using your phone?
Yeah, I'm trying to get my computer back on, but it's I don't know what's happening. Let's just go ahead.
Okay, that's fine. Can you adjust your phone? Maybe turn it long ways. Okay, there we go. Perfect. Yes. So you were explaining about your program and how you had a family within your program, from your program director to other professors, and they were understanding of where you were with your education at the point of your entrance.
Yeah, so as I was saying, they were very supportive. It was like, we're like family, right? So I didn't really feel it a lot. So I was there until I went to Liberia to do my research. And then I did my research in Liberia for 6 months. So after doing my research and gathering all of my data, I came back to the US to get ready for my thesis presentation and my graduation. And then COVID hit. So when COVID hit and they decided to close down the schools and told us to go back, like everyone should go back home. Mm-hmm. I couldn't go back home because home was Liberia and I was in the US at the time. So where can I go? And all of my classmates left. So I was just in the building alone. And I just decided, okay, let me just go and start with a friend. So I was there at the same time doing my online courses, my virtual courses. And it was actually meant to be a big celebration during the graduation, but it was so sad that during the graduation, I just had to sit before the computer like this and just watch the degree being conferred. Like all my families, everybody was away. I couldn't get to anybody. And yeah, we went through the graduation, but honestly, coming from Liberia to attend in the US is a complete different experience. Looking at the fight of our educational background in Liberia, it was actually challenging. The first semester, the first 6 months, it was challenging for me, but I was able to go through that, and here am I today.
Wonderful. I mean, this is a wonderful story. That's why I haven't stopped you at all.
I know.
Yeah. Into the story. So that's wonderful. So you have a master's in public health, correct?
Global health.
Global health. Okay. Yes. So with what you've learned in the time during your education, what were some things that you had those light bulb moments where you said, oh my goodness, we should be doing this in Liberia, or oh my goodness, we're doing the exact opposite of what we should be doing? What were some of those moments during your education when you thought that?
Yeah, so the thing about global health is that global health looks at the patient care holistically. That is, they look at both the social aspect of the patient health as well as the health aspect. And then when I look at what they were saying to us about in global health about the patient, like you don't just look at the fact that a patient's supposed to take their medication. Look at the fact that whether this patient have food to eat, whether this patient can even have the transportation to come, to the hospital for their regular treatment. And then I was sitting, I'm like, I think I'm guilty, because usually in Liberia we tell a patient, oh, why you miss your treatment? And not even thinking, considering the fact that maybe this patient never even had transportation. Maybe this patient never even had food to eat. And that was the reason why she missed her treatment, right?
Okay, one moment here. We are live with Yassah Lavelah, and here she is.
I actually found myself guilty, and I also thought of the fact that in Liberia, here in the US, they prioritize healthcare, especially when it comes to the issue affecting women. It's like a priority. And I found out that in Liberia, we were doing like the opposite, right? Imagine in Liberia, so when I went to do my research, I actually thought I knew what was going on in the health sector until I went back to do my research, sitting one-on-one with these women. And then I found out that I never actually knew what was happening in the healthcare sector. When I listened to women telling me that they prefer a traditional midwife to a skilled midwife, then I'm like, what? And then I asked, and they're like, we trust the traditional midwife more than the skilled midwife, because the skilled midwife, they don't keep secrets. They don't talk to us good. They are very rude. And they started to name some of these different reasons why they prefer a traditional midwife. Then I'm like, God, I thought I knew what was actually happening in the health sector, but I never knew what was happening in the health sector. And then when I look at the fact that global health talk about policies that will help to work for the masses and not just few people, right? And I figure out in Liberia, we don't really look at policies, right? We look at just doing things on a smaller scale as though we are still responding to an emergency. Then I figure out that we're actually doing things the opposite way. And those are some of the moments that I sat down, I'm like, okay. And then there was one moment we discussed something in class talking about all of these different agreements our different governments signed to. And I figured out that our government is like signatory to all of these different agreements, but they are doing something different from these agreements. And coming to Harvard, sitting with the experts, right? And having this discussion, I was like, we are far, far, far behind. Yeah.
Okay. Well, so I want to jump more into the women's reproductive health discussion. So define for us, what is women's reproductive health? What all is entailed in that?
Okay, so I would look at it from the point of the World Health Organization, right? So the World Health Organization define reproductive health as the state of complete mental, physical, and social well-being, and not just the absence of disease and infirmity. Because most of the time when people talk about reproductive health, people just look at the presence of a disease condition. But the World Health Organization said, no, we should look at the physical, the mental, and the social well-being of people when we are talking about especially reproductive health, right? So it has to do with everything concerning the reproductive health of a woman, that is her physical well-being, her mental well-being, her social well-being, as I was saying. And that's how WHO defines reproductive health. So everything that has to do with the function of the reproductive health system mentally, physically, and socially, and not just the absence of diseases.
Okay. And so we hear women's reproductive health, and then we hear like sexual health or sexual education. Are they the same? Are they different?
So the sexual reproductive health, health and reproductive health, most of the time is used together, but we need to be careful because sometimes when we are not careful, we just look at this, we pile up the sexual health aspect within the reproductive health aspect. But as per the WHO definition, because I love to take it from there to push it further, it's sexual health. Sexual health, I just define reproductive health, right? And then it talks about sexual health, talk about everything that has to do with sexuality, right? And we need to be careful about it, like I said. Talk about how the body, the sexual health function, and then it's closely linked. And then sexual health deal with the comprehensive health. So you talk about the sexuality of a woman, talking about how she's supposed to determine whether she wants to have sex this time or don't have sex this time, what a woman is supposed to do with her body. And that's what the whole sexual health talks about. But usually it's usually combined when we're saying it, we just say sexual and reproductive health, because it is through sexual health that we get to reproductive health. And then when we talk about reproductive health, we're talking about antenatal, that is when you are pregnant, or prenatal, before pregnancy. We talk about intrapartum, that is during the birthing process. We talk about postpartum. So everything falls under reproductive health. And then, like I said, sexual has to do with, like, some nowadays they usually also talk about a person can decide what kind of sex they want to identify with. A person can decide how they want to have sex, when they want to have sex. So that's just a slight difference. But sometimes we need to be careful how we use the word, because if we're not careful, we will just push everything under reproductive health.
Okay.
Yeah.
All right. And so what are some of the issues or women's sexual and reproductive health issues?
Okay, most of the time, let's start from sexually transmitted infections, because it's a whole big topic. And some of the sexually transmitted infections we have, we look at gonorrhea, we look at trichomonas vaginalis, we look at cancer. Cancer is not sexual reproductive health, but it's also part of, it's not sexually transmitted, but it's part of the reproductive problems that women face, right? And so we talk about cancer, we talk about fibroids, uterine fibroids, the abnormal growth that usually happens to women, it grow within the uterus. So those are some of the reproductive health problems that women usually have. There are lots of different ones. And with cancer, we have different types of cancer. We have the breast cancer, cervical cancer. So we have different kind of reproductive cancer that women face. And we also have endometriosis, right? That one is abnormal growth within the uterus as well. But that usually women experience the symptoms of that when they're actually seeing their menses, where they have intense pain. But then it's actually confusing. Most women don't usually pick that up, or they just relate it to menstrual pain. They say, oh, I'm having menstrual pain. But when you have endometriosis, the pain you have is severe than the ordinary menstrual pain. And that's where a woman can actually, if she actually goes to a doctor or gynecologist, the gynecologist will ask her the severity of her pain, how it happens to her, to determine whether it's a normal menstrual pain or it has to do with endometriosis. So there are different reproductive problems that women go through, but I just name a few here for you.
Okay, thank you. And so what are some common issues in Liberia?
So I will speak from my experience and the work that I do. So one of the major issues in Liberia has to do with maternal death. Women dying during pregnancy. Currently in Liberia, our maternal death rate our maternal death stands at 1,072 per 100,000 live births. So if we look at the baseline for WHO says it should be around 70 per 100,000 live births. So for our rate, we have 172 women dying out of every 100,000 live births, which is like high, 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 high. And WHO says by 2030, we should have at least our maternal death rate should be around 70 per 100,000 live births. And when we look at the factors that actually contribute to the maternal death in Liberia, these are things that we can address if we really want to address it. Because if you look at postpartum hemorrhage, that is a woman bleeding after delivery. Postpartum hemorrhage, we have anemia, we have sepsis. These are things that we can prevent when a woman is going for an antenatal visit before she even gets to the delivery point where she will go through the emergency part. But something I would tell you, all of the different reports we see around here is actually far from the reality on the ground. We have women dying at a very high rate, and sometimes it's not even reported because they die in the community. They die in the community, and the traditional midwives will not report it because they are afraid. So that's one of the major problems we have in Liberia. Another problem we have is teenage pregnancy. And our teenage pregnancy rate somewhere around 33% in Liberia. The teenage pregnancy rate is so high in Liberia. And the thing is, no one is talking about it and no one sees it as a problem. And when we talk about the teenage pregnancy rate and the maternal death rate, the thing about the maternal death is that most women will prefer to give birth in the community than going to the health facilities. And when you ask them, they will tell you the things that people will ask for to the hospital, I don't have it. One. Two, the midwives at the hospital, they don't respect people. They will insult you when you go to the hospital. And three, sometimes they say they don't have money. And if you ask questions in Liberia, they will tell you the public facilities, they will say that free of charge, free service. In fact, when you go there, they will tell you, say free healthcare services. But here, it is not free. Because how can you say it's free when you ask a woman to buy fuel for the generator before she gets admitted? Yes, you ask her, you will prescribe her medication on the paper and tell her to go and buy it. A pregnant woman goes for antenatal visit, she will be asked to pay to buy a pair of gloves before she can get checked. So is it really free? It is not free. And then she gets in labor, she goes for delivery. If she went without the materials they ask her, which is the sanitary pad, the baby diaper, the tissues, if it's an emergency, they will accept her and conduct that delivery. And then they will detain her, they will detain the woman and the baby until she paid the money for those stuff, or her family bring the stuff they ask her for before they can release her. So if you look at all of these things, the women say, you know what, we'll just go to the traditional midwife and give birth behind the house. And that's one of the major things I see, because no woman is supposed to just die giving birth, especially from preventable, reasons that we all can work on. So currently, that's one of the major problems in Liberia when it comes to women's reproductive health in Liberia. That's one of the major problems we have with the increase in teenage pregnancy. And sometimes the thing about the teenage pregnancy, they are not just getting pregnant by boys who they consider as their boyfriends. Sometimes they are getting impregnated by their own, someone they call uncle. They are getting raped and getting impregnated. So these are just some of the top problems that I see in Liberia.
Okay. And so you also started a Facebook Live program. So how is that going? Why did you start it? What is it?
So like I said, when I was in Liberia, I conducted sexual reproductive health education for teenage girls in Liberia. And leaving Liberia and coming here, there's been this gap because that program has stopped, even though the clinic is still functioning, but the sexual reproductive health program stopped. And I've been getting messages from some of these girls in Liberia, oh, into Yassah, when you coming, when you start a program again. And then also some personal friends that I have reached out to me and said, Yassah, I was experiencing this problem. And when I came to the US, I visited a doctor, and this is what they told me. And since I started to do this thing, I see some difference. Like a friend reached out to me 3 weeks ago. She was actually one of the reasons why I started this program. Yeah, Yassah, there is something on my mind I really want to talk to you about. I said, what? She said, When I was in Liberia, I was always coming down with infection. She said I would go to the hospital, they would just give me a starting cream or some medication to take. I would take the medicine, but then after a few days, the infection would come back. She said, so it was just like that until I came to the US. She said, when I came to the US, I decided to go to see the doctor. She said, before I went to see the doctor that morning, I took shower, I went, put my finger in me, I cleaned inside me, I took out everything from inside me. So she said when she went to see the doctor went to do a pap smear, and the doctor asked her, but there's nothing in here. She said, yeah, because I just took bath and I clean up. She said, the doctor said, now I see where your problem is coming from. The doctor said, the fact that you are putting your finger in you every time and cleaning all of these things is the reason why you are constantly coming down with infection. And she said it was strange to her because in Liberia, our parents told us that when you go take shower, sit down and clean inside you as a woman. She said it was difficult when the woman told her, don't clean inside, you just clean outside your vulva, use clean water and towel and just clean outside your vulva. She said that was like, I'm not going to do this. She said, within herself, she said, I didn't tell the doctor, but I told myself, I can't do it. Mm-hmm. But when she went home, she said, let me just try it and see. So she started to use the painting liners in her own clothes because she said it was getting wet often. She started to use the painting liners. And so she said, the first week, she figured out no itch, no, offensive discharge. She said, but it's like this thing is working. So she said she started to do it, and sure, all the infections stop, all the itch stop. Then she said, so that means the thing they've been telling us in Liberia was actually wrong. So she said she been wanting to come on Facebook to say, but she said, I said, I'm able to say it. So she said, I said, I beg you, you say you can do Facebook Live, you sure that I want you to really talk about this thing. So that was how I decided to talk about it. The first day I decided to do that live, I had almost 5,000 views.
Wow.
And then after the live, I had people in my inbox. I was like, can you do more of these kind of topics? She said, sometimes we are not able to discuss our problems to people, but with the education, it's really helpful. And everybody was telling me, continue. So I decided, okay, since I've been doing this in Liberia, so I think it's another way of continuing what I was doing in Liberia. And trust me, since I started to do it, the feedbacks I'm getting is really encouraging. I mean, people who you will consider, okay, this person knows exactly what to do. You will be shocked that they will come and tell you, I never knew this thing you were telling me. I never knew. So that's the reason I decided to do the women's health and hygiene. And it's been going good this week. I couldn't come on because I wasn't feeling too okay. Everybody was like, oh, Yassah, please, we're praying for you to get well. And then the men started to tell me, why are you only doing it for women? Why are you only doing it for women? We're the men, we want you to do it. So it's like, yeah, I see the need. People are seeing how helpful this thing is. So I've decided to continue the show, even if it's just once in a week, to come up and have these different discussions. That's why I decided to do it.
Oh man, well that's a wonderful effort, and thank you, right? Because it's definitely helping lots of people, especially when the information just isn't there, or that the information they have is contrary to what is true. So thank you very much for that. Also, you have some activities still going on in Liberia. So tell us about what's going on right now and what you plan to do.
Yes. So like I said, the clinic is still operating, and where the clinic is situated is a community that, in fact, we are overwhelmed right now because the Chop area is a slum community. Mm-hmm. And most of the people that they can't even afford to pay for healthcare services. So most of the time we do deliveries, and then we have to feed the patient, we have to buy clothes for the patient, and just tell them go. Because imagine you have our underprivileged brothers and sisters we call Zogos, because we are located right around the ghetto. So you have these pregnant underprivileged brothers, sisters coming to us for delivery, and they can't pay you. They will just give breast. Sometimes they tell you, say the baby for you, take the baby, we want the baby. Exactly, yes. So the clinic is still running, but we are overwhelmed. And since the COVID started, I've been raising money to feed pregnant women, breastfeeding mothers, and traditional midwives, because I figured out that even with our COVID during normal times, we have pregnant women complaining that they don't have food to eat, breastfeeding mothers. So then I started to think, I'm like, okay, COVID, and there's going to be a lockdown. So I was just imagining what exactly was going to be like. So I decided to just come on Facebook, and then I was surprised. We raised almost $2,000 plus. We're able to feed, I think 125 women, including pregnant women, mothers, and we're able to feed 15 traditional midwives as well. We gave them a bag of rice, and our feeding program continued until I think last month. We did the last feeding, and then we've been able to also provide buckets, hand washing buckets, and hygiene materials to traditional midwives as well. So usually we do under 18 deliveries free, and I usually ask friends to use their birthdays to raise some money to continue that project. But of late we stopped because we ran out of funding. So I currently have a GoFundMe going on because next year I'm talking about launching a project called the Better Birth Project. So the Better Birth Project will be looking at changing our delivery tables from wooden tables to real delivery tables, ensuring our delivery rooms we have nice setup, nice lightings, all of the materials we need, ensuring that we have birthing kits. So the kids that are pregnant with me can afford to carry when they go into the hospital to have baby diapers, sanitary pad, tissue in a bag, and ensure that we can give it to pregnant women. And we also want to introduce a program where traditional midwives can serve as companions to pregnant women to ensure that they attend antenatal clinic, to ensure that they give birth in the clinic. And that's what the Better Birth Project will be about. We'll also be talking about continuing our feeding program for pregnant women and mothers. So I have a GoFundMe currently going on Facebook, and even though it's going slow, but at least my friends have been coming forward and say, okay, Yassah, we can do this. We will donate. I have a friend who says she will donate $200 every month until January. So it has been going, even though it's slow, but the people are actually welcoming the project. And then I'm hoping I can go back to Liberia next year because my goal is to actually improve maternal and child health in Liberia in whatever way I can do it. But my thought was like, once we empower health workers, they are able to actually work with pregnant women and children. Once we improve the community, that is traditional midwives, husbands, caretakers of pregnant women and mothers, once we educate those people and let them know what are the danger signs and what they should be doing to ensure that pregnant women can attend the health facilities, these things will be done. So that's what I'm doing. I'm hoping that next year, latest March, I can be in Liberia. And I'm also working with a group here in the US called Lavelah. It was funded by some of my classmates from Harvard. And they are providing sanitary pads and menstrual hygiene education to girls. So we're able to distribute sanitary pads to 125 girls in Liberia when the school reopened, and we give them menstrual hygiene education. So March, they are also trying to do a fundraising where they can build bathrooms and have sanitary pads in the bathroom for girls. So that project also will be doing one school first because we actually targeted 5 schools, but it's very expensive to do the 5 schools. So we currently have a GoFundMe ongoing too for that project. So next year, going to Liberia, these are some of the things I will be doing when I get back to Liberia next year. Yes, so that's what I'm looking at. And my goal is to actually lobby for funding to see how best I can improve maternal health in Liberia. That is my goal.
So, I mean, I heard a couple of GoFundMe. So please tell our audience the name of the GoFundMes, how they can find it.
Yes, so we have 2 GoFundMes going on right now. One is by Love Your Menses, an organization in the US here. And they are raising that money to build latrines for schoolgirls. And the next one is my GoFundMe called Better Birthing Project. And that one is to improve the delivery facilities we have currently for women in Liberia. So one is by Love Your Menses, and that is by the Bathroom Project. And another one is by me. My name is on it, and it's called the Better Birth Project. So that's 2 GoFundMes currently going on. Yeah.
And so the Love Your Menses project, do you know which school they are raising funds for?
Yeah, the school is called Brighter Future Academy. I actually selected the school. Okay. Yeah, so the school is called Brighter Future Academy, and it's in Red Light Gorbachev. It's a school. It's located in a slum community. When you take a look at the bathroom they are currently using, you will say yes, there's a need to really build a bathroom for them. Yeah.
Okay, interesting. So also, before you go, I want us to talk about what your call to action is, right? What can Liberians do? What can the government do? What can we do to help, women's reproductive health, child health in Liberia?
So before I go to my call to action, I just wanted to remind Liberians and remind our government that we actually sign different commitments. We are part of different commitments that world leaders sign. And one of that commitment is the Sustainable Development Goals. And for me, I usually look at goal number 3 that talks about ensuring that we reduce the maternal death rate by 2030. That is one of the things, to less than 70 per 100,000 live birth. We are part of this agreement. We signed this agreement. And apart from this agreement, we also signed another agreement called the Alma-Ata Declaration. And that declaration talks about ensuring primary healthcare service is key and every person should have it. We also signed a declaration that talks about universal health coverage, that is providing healthcare services for everybody, despite your financial status or so. And if we are part of these different agreements, if we sign these different agreements, I think it's something our government should consider to look at and say, we actually say yes to these agreements. It is something that we need to work on. So my call to action to the government would be, we should look at policies. We should look at policies that will work in the interest of the Liberian people, especially women's health in Liberia. For me, I'm usually particular about maternal health because women are the foundation of a family in Liberia. When you look at it, if a woman died during childbirth, that entire family is devastated. That entire family is devastated. And the thing about having a child, we all know in other countries, is about happiness. It brings joy. But in Liberia, having a child in Liberia is like a death sentence because everyone is worried. Is the mother coming home? Is the baby coming home? Will the mother and the baby come home? It's like a death sentence. But I think when we have policies that work, partners can come and take a look at that policy and say, you know what, we will flow with this policy. But when we don't have policy, everybody come and just do what they think is best or do what they think is okay for their organization, right? We should have priority. We should prioritize maternal and child health. There are documents that says the government prioritize maternal and child, but those are just papers. These are just writing. We need to take those writings and make them and put them into action. And I think there are other smaller things that we need to look at as a people, as a government, that we are overlooking. The fact that we don't have good roads, we have maternal waiting home, because this maternal waiting home is like a transit house for communities that are far away from health centers. But we have this maternal waiting home, and we are not supporting this maternal waiting home. My organization currently works for maternal waiting home in Banga. This maternal waiting home is built right near Phoebe Hospital, and you have pregnant women from different towns and villages coming to that home just to wait for birth, to give birth in the hospital. The last time I went there, they never had any food. No food. So if you are pregnant and go to that home, you have to feed yourself and feed your children at home at the same time. So because of that, most of the women just stay home and give birth in the community. The last time we donated 15 bags of rice and some money and rice, but right now they are out. They just called me to tell me there is no food in the home. So once we have these maternal waiting homes equipped, definitely, and we have a very good referral system, we will have women going there to wait for birth, in the health facilities. 1. 2, we have a lot of traditional midwives in Liberia. Trust me, whether we like it or not, we can't do away with these people. It is now time that the government think about integrating these people into the health system, maybe, and redefine their role, because the government is saying they don't want these people conducting deliveries because they are not skilled. Okay, we agree. But we have these people in town and villages where we don't have health centers, we don't have hospitals. And you have these people. Can you tell them to stop? And they are doing delivery for livelihood. And then the government is saying they shouldn't do delivery, but they don't want to pay these people for the work they are asking them to do. We need, whether we like it or not, we need to work with these people The government needs to integrate these people, train them, redefine their role, and pay them or compensate them for what they do. Or else we are not ready to address the maternal death rate in Liberia. And another thing is we need to focus on studies that will look for strategies to bridge the gap between the private health sector and the public health sector. Because guess what? There is this lack of trust in the public health sector. Women who can afford, they will say, I will send my baby boy and go to the private clinic or go to the traditional midwife, because the government hospital is complete waste of time. So we need to look at studies that we find strategies to figure out what is it the private facilities doing or these traditional midwives are doing that these women are really going after and leaving the public facility. We need to focus on strategies to really look at the gap between there. That is my call to the government, and we should look at policies, put policies in place. So individuals in Liberia and abroad, like I said, sometimes we should ask ourselves, how can we help? How can we give back to our country, right? You don't have to be rich to give back to your country. I tell people, I say most of the time, I see people using their birthdays to raise funds for Cancer Foundation in the US. Use that. You could use that particular birthday, even if it is 200, and look at one organization in Liberia that is helping and say, you know what, I will donate to this organization. You know what, how can I empower this school to serve more kids? And some of the initiatives that we are doing, I want us to look at sustainable initiatives, because the thing is, we do the donation. After the donation, what next? We get ready, we say, okay, I donated 50 bags of rice to this hospital. When the 50 bags of rice is finished, what next? So we should start to think about sustainable initiatives. Okay, how can I empower these people to continue buying their own rice? How can we empower pregnant women to continue feeding themselves? Am I saying the donations we are doing is wrong? No, the donations are good. But while we do the donations, let's start to think about sustainable initiatives. Let's start to think about how we can empower people to fish for themselves instead of giving them fish all of the time, because we will not continue doing that. That is my call to individuals here in Liberia. Let's look at private initiatives. You can say for this year or next year, my family and I, our goal is to make sure maybe 5 pregnant women in Liberia have businesses to feed their children, right? You can't do it one time, small. We can say Liberia, small. You look at one woman, you say, you know what, I want to work with you. Let's do this business. Let's test this thing and see if it's going to work. Sometimes it's not just all about the government. The government has a part to play, but we as Liberians, individual citizens, have our part to play. The sanitary pads we distributed to those girls in Liberia, how much we use? $500. $500 we're able to give 125 girls 3 months of period supply, right? So like I tell people, $100 so it's going to help. Like the deliveries we do in Liberia for under 18 girls, people number $50 for one person, right? So it is upon us, even though our government has a part to play, but it's upon us as well to help our country. So let's not just sit and talk and criticize. It's good to talk, it's good to criticize. But as we criticize, let's ask ourselves, what is it that we can do as individuals to help our country? So that is my call to action. Our government should look at policies. They should look at some of these smaller things that we overlook to actually work with. That is my call to action.
Okay, well, thank you. Thank you so much. And I actually had a couple other questions for you, and I was going to see if our audience also had questions. But with the clinic that you currently have, how much staff do you have? How are they supported? How are you able to pay them?
So currently we have like 8 staff. We have the janitor, we have 2 registered nurses, we have a midwife, we have a dispenser, we have a lab technician as well. And we also have traditional midwives that work with us because they go to the community and talk to pregnant women to come. So helping us when the past regime was paying our vaccinator, right? We're paying our vaccinator, we're training them. But since the current regime, it's been really difficult. And they usually supply us with drugs the Ministry of Health used to supply us with drugs, but since the current regime, it's been really difficult to even get supplies from the Ministry of Health. When I was there, the U.S. Embassy gave us funding to conduct projects, and through that, we're able to sometimes sustain the clinic. So we usually do fee for service. So those patients who are able to pay us, they pay us, and sometimes what we get from there can help to sustain the clinic as well. But it's been really challenging. Most of the time, like I use my personal cash just to ensure that the clinic is running. Because the thing is, even though the clinic is there, we need to do it, but sometimes if you just have clinic for a day, you will feel bad when you see people from the community come in, you can't serve them. It's a serious challenge. So that's the reason why when I graduated, I wanted to go back, but I asked myself, what do I have to offer Liberia right now? I agree, I'm educated right now, but can I really impact my community and impact people through the work that I'm doing currently? Now, my answer to myself was, I don't think so. So staying here, lobbying around, working and saving some money will actually empower me to give back. That's the reason I'm here. It's very challenging with the clinic, but we lobby sometimes. The Mozzarella County Health Team, when there's a workshop, they include for government facilities. But because of the work we do, our report we give them, you see the impact we are making. Most of the time, they include our clinic in most of these trainings. And sometimes when they have some supplies, they call us for it. But it's been really challenging to keep the clinic running. It's been a serious challenge.
Okay. Is there like a way that people can give to the clinic or donate supplies to the clinic? Are you doing any shipments? Can people donate in-kind material for your clinic or any of the projects, the Better Birthing projects?
Yes, people can donate in kind. If you want to donate in kind, we appreciate it. You can donate delivery tables. You can donate tissue. You can donate drugs, over-the-counter drugs, but it's hard to get other drugs here except over-the-counter. You can donate baby blankets. You can donate baby diapers. You can donate sanitary pads. Just anything you think you can use in a hospital and a mother will use, you can donate it. We will accept it. You can donate cash. We accept it. You can donate kind, because usually we do shipment. So I get stuff from here, ship it to Liberia, get stuff from here, ship it to Liberia. That's what I've been doing. So we will really appreciate donations in kind, in cash, whatever way. We even got people in Liberia that can call me and donate rice. Yeah, the last time some people called me Liberia, they donated rice. Somebody donated money. Somebody donated $100 from Liberia. They took it to my mom, to the clinic. Yes. So we appreciate donation in kind of money.
Oh, well, that's a blessing. So before you go, also, like we said, you have your Facebook show. So how can we watch it? How can people find you and view the show?
Yeah, so I'm friends right now with what's his name? Anthony. Mm-hmm. And I can usually share it on Facebook. Yes, when I'm going live, I usually share it on Facebook. Yeah, so I use my personal page to do the show. So I share Facebook, and on Sundays and Wednesdays. I usually come on Sundays and Wednesdays. Yes, so I will be on tomorrow. Hopefully tomorrow I will be on, because this whole week I was missing this whole week. So tomorrow I'll be on, and then Wednesday I will be on. But I'm trying to do it like once a week because I'm a little bit busy too. So I'm trying to do it like once a week. But for now, I'm doing it on Sundays and Wednesdays.
Okay, and your personal page is Yassah Lavelah. Is your full name?
Yes, that's my personal page, Yassah Lavelah.
Okay, well, thank you so much. We've had a lot of great feedback. People were very inspired by your story. Let me read a couple of comments that I'm still able to see. Benedict Phillips said, all a failure of government with no plans of health, simply inept. We can't do all these things with no infrastructure. Government needs to provide their environment. Bravo, Yassah. Hoping that you get the support that you can succeed, so that you can succeed. Share the info about the GoFundMe. So definitely before we leave. Oh, okay. Well, I see some of our teammates have put in the GoFundMe links in in the chat, so they have access to it.
Thank you.
So please donate to Yassah's initiative, the Better Birthing Project. She also has, so the clinic is Mavi's clinic, right?
Mavi Maternity Clinic. So it's named after my mom. The clinic,
Okay.
the NGO is named after my mom. Like I said, my mom is a champion for women's and children's health. So whatever I do in that line, I'm doing it in her honor. I don't have to wait till she's dead, you know.
Right.
I can set up a foundation for her. I decided to actually do this while she's alive to let her know that her legacy will continue even after she's gone. Her legacy will continue. So I mean, I don't have to wait until she's dead and then I say, oh, I want to set up a foundation. No, I mean, she's dead. I mean, once the person is dead, they're dead. They will never see what you're doing. So I decided that my mom will be alive. Why I do this? So when I'm going back to Liberia next year, I'm going to have a very big and formal launch of this organization. Yeah, so to just let her know that her work will continue even when she's gone, even after she's gone. Maybe I don't want her to leave right now. I'm keep her yet, but nobody is here forever. So the day God calls her, I just want her to know that her work will continue.
Thank you so much. Thank you for being here. Thank you for sharing your story. Thank you for the work that you do. And to our viewers, please support Yassah's projects. Like we said already, she has the Better Birthing Project on GoFundMe, and she's also helping to support Love Your Menses with funding to help a school in the Gorbachev area to put in a bathroom, a proper bathroom for the children to have. And then also Mavi's clinic, you can support her with that as well, whether you want to send food or, you know, buy rice or buy things for women who have just given birth or for babies. In-kind donations, money donations, all would be appreciated. I know you guys are inspired by the work that she's doing, so please help support her efforts. Okay, and Yassah, please just give us your final thoughts before we sign off tonight.
I mean, it's been such an honor to. Hello?
Yeah.
Hello? Okay, it was freezing.
Yeah.
I mean, it's been such an honor here on this show, Focus on Liberia. I'm very much proud to be here today. And I just want to say, continue your work, continue to use this platform to put out some things about Liberia, to allow people, to let people know, because sometimes the work we do, people don't know what we do. But a platform like this, you know, having us on this kind of platform to just talk about what we do and talk about issues back home is actually a form of awareness. So I just want to say kudos to Focus Liberia and thank you all. And my final word is, as citizens of Liberia, it is upon us as well to ensure that we help our country. I agree the government is upon the government to do a lot of things, but we too can help in our own smaller ways. Let's agree, let's assume, okay, the government have failed us. Let's assume that let's agree to that. It's upon us now to wake up as individual citizens and tell ourselves, you know why? We can help our people in different ways. So thanks to everyone who was watching. I appreciate you. And please do not forget, you can donate in any ways. If you have used baby blankets that you know you don't have use for anymore, you baby clothes. There are people in Liberia who need this thing. We will really appreciate. You don't have to give us cash if you don't have cash. Give us food, give us clothes, give us diapers, sanitary pads. We would appreciate it. So once again, thanks to Focus Liberia, thanks to the entire team, and thanks for having me. I appreciate it. Thank you all.
You're welcome, and you are always welcome here. We'd be happy to have you again sometime. Maybe you can give us an update on your projects, especially once you get to Liberia. But we want to keep the conversation going. So thank you, and thank you to our viewers. Thank you for tuning in. You can join us on.
Yeah,
I'm sorry if I break it.
Oh, that's okay.